Hello and welcome to Health Professional Radio. I'm your host, Neal Howard. Thank you so much for joining us today. Our guest in studio is Dr. Ted Rosen, a professor of dermatology at Baylor College of Medicine, also chief of dermatology service at Michael E. DeBakey Veterans Affairs Medical Center in Houston, Texas. And he's in studio today with us to discuss STDs, sexually transmitted diseases. He's an expert who specializes in the treatment and diagnosis of STD and non-STD genital lesions. And we're here to address some of those issues. Good afternoon, Doctor.
Good afternoon. Nice to be with you.
Welcome to Health Professional Radio.
My pleasure.
You're an expert in the most common STDs, those that I guess plague us the most. When it comes to identifying them, I guess the most important thing is to be able to identify them. I guess that comes after preventing them in the first place. Would you agree with that?
Certainly, if a disease can be prevented, that's the best thing of all. And we do have vaccines for a number of diseases, including at least one of the sexually transmitted diseases. Vaccines are great, but not everyone receives their vaccines, and some people are concerned about the potential long-term health effects of vaccines. So the other way to prevent a disease would be to avoid it. And of course, the best way to avoid sexually transmitted diseases is to be abstinent or to be in a mutually monogamous relationship with someone who isn't infected. Both of those are somewhat unrealistic for a majority of the sexually active adult population.
I mean, we've been hearing that for decades and decades.
Yes, it's true. And, people have asked, well, why do we still have sexually transmitted diseases? But the reality is that a lot of the folks walking around today don't really realize how prevalent these are. And of course, people do things that they regret later when they've had a little too much to drink or too much to smoke. And, it is what it is.
Are there vaccines for all sexually transmitted diseases today?
Oh, no. Unfortunately, the only one we really have a vaccine for is human papillomavirus in terms of the sexually transmitted diseases.
So there's only one that you can prevent through the vaccine. Everything else has to be treated. Can you be vaccinated for HPV and still contract it or pass it on? Or is it, once you have the vaccination, is it something that, boom, you're covered?
Sure. There are actually 3 vaccines. They're slightly different for HPV. It's my understanding that by the end of this calendar year, 2016, one of those vaccines will no longer be offered because part of it is already included in a larger vaccine that has more HPV types. And so we will have one vaccine that protects against 2 varieties of human papillomavirus. Those are the ones that are predominantly responsible for genital cancer. And then we'll have a nanovalent, that's 9-valent vaccine that will protect against the 2 most common forms of HPV that cause genital warts, as well as 7 different varieties of HPV that cause cancer. But notice I said the most common types. So yes, while the vaccine prevents against the most common, it does not prevent against all the types that can cause either warts or genital cancer.
Okay, so if there are so many different types of one STD, what, in your opinion, is the reason that one is so prevalent where the other's kind of hit and miss? Is it location, activity, age? What are some of the factors that contribute to that, in your opinion?
The different STDs are transmissible at slightly different rates. So even though you may be in contact with someone with some of the diseases, they're not as readily transmissible. Also, it depends upon the prevalence in the entire population. So, for example, HPV is, if not certainly one of the most prevalent diseases in society today. In the U.S., there are close to 80 million people who are infected with HPV. We get roughly 14 million new HPV cases a year. That's not all external genital warts. That's all HPV. But even if you look at external genital warts, 1% of the entire sexually active adult population has external genital warts, and it's estimated that there are about 350 to 400,000 brand new cases of external genital warts. So you compare that with syphilis, which is, of course, a very old disease. This goes back to, Renaissance and Reformation time. But syphilis, syphilis, there were 20,000 cases of infectious syphilis. So you compare 20,000 to 350,000 cases. So you see, some are more common just because they're more common in society as a whole.
What steps are you personally involved in getting the word out on a much larger scale so that everyone knows the increased risk, the unknown risk that they're already trying to prepare for?
So I think there are several levels of education that one can look at, and I've been involved in all of them at one time or another, and am still involved in some. So let's take the very first level of education, which is talking to our young people. So you have people who become sexually active in their adolescent years. Many of them have courses that are required, health courses that are given in high school years. And it's important to have people who will talk openly, frankly, and explicitly to our young people and explain what the risks are involved in sexual activity and what these diseases are, what they look like, what to avoid, how to try and prevent them. And I've done that, high schools here locally, or I've taught people who then go to high schools and teach these kind of courses. Of course, health professionals of all type who are available and willing to talk to their patients. That's primary care physicians, physician assistants, nurse practitioners, primary care, internal medicine, OBGYN, urology, and dermatology, because after all, these are on the skin. All should be well versed in these, and I've given courses and continue to do so to all of those groups so that they're well educated and can talk appropriately to their patients that they see on a daily basis. So it starts as a youngster, and it certainly carries on in adult life with the healthcare providers being available, being willing to talk about the subject. Some people are reticent to do that, even healthcare professionals, and then giving good information to patients.
Where can our listeners go online to get more information specifically about HPV and about you and your work as well?
Well, the best place to get general information about STDs is at the government, one of the government websites. Actually, it's something the government does well, and that would be for a change, that would be CDC, www.cdc, that's Center for Disease Control.gov. And there's information there on all sorts of communicable diseases, and there's a little tag that says STD, or sexually transmitted disease. You click on that, and it'll give you some pretty good information. It's written for the public. There's a part that's written for healthcare providers, certainly, and healthcare providers can go to that. And if someone wants more basic information, they can do that. For HPV, there are any number of websites. I think almost everybody's facile at using Google, and you can find some of those websites and get specific information. Have to be a little careful about websites because some don't offer the best information. I really like the CDC as a good, non-biased, fair information provider about sexually transmitted diseases.
You've been listening to Health Professional Radio. I'm your host, Neal Howard. We've been in studio talking with Dr. Ted Rosen, professor of dermatology at Baylor College of Medicine, also chief of dermatology services at Michael E. DeBakey Veterans Affairs Medical Center in Houston, Texas. We've been here discussing today some of the most common STDs, the most common HPV STDs, as well as how to identify them, and we've touched a little bit on the treatment of some of these diseases. It's been great having you here with us today, Dr. Rosen.
Thank you for having me.
Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can also subscribe to this podcast on iTunes.